Welcome back to Dumbest in the Room. We had a little bit of a hiatus, but we're back, and today I'm joined by Dr. Paige Downs. She's actually my dentist. She's fixed my front tooth. She's a bit of a legend. Dr. Downs, thank you for being here.
You're welcome. Thanks for having me.
So, Dr. Downs, how did you get started in dentistry? Like, what was that first spark for you?
I knew I wanted something in science, so I did a degree in biochemistry and really knew it was going to be something in medical dental. Dental kind of came up because I had a lot of friends going to dental school, and I got accepted into medical school, but I started thinking about it. I'm like, that's going to be a lot of long hours, and I wanted a family and, something outside of just the hospital, but I still wanted to do something with my hands and not, just be 8 to 5 in the office. So I wanted, kind of surgery-esque kind of things. So my friends that were going to dental school was like, hey, we're going into dentistry. It's pretty cool. My dad's a dentist, my uncle, this, that. So that's just it. I happen to love it. So again, I knew something medical dental. I just didn't know what. And then when that came about, it worked perfectly.
Awesome. I noticed when I was doing a little bit of research before this, you're DMD. What's the difference between DMD and DDS?
So believe it or not, where that started was, I believe it was Harvard. So when Harvard developed their dental school, everyone else was Doctor of Dental Science, and Harvard wanted to be different. So they came up with the Doctor of Medical Dentistry degree, and then some of the newer schools followed suit. So in this area, like MCV is DDS, Baltimore's DDS, but some of the newer schools, especially down south, are DMDs. So they kind of followed suit because I don't know if someone thought it sounded more prestigious. It's pretty much the same. We had, for my school, because we were very, very small, we had a lot of our core classes in with the first year. When we were first year, we were in with the first year medical students in some of the neuroanatomy, a little bit of gross anatomy. So it kind of consolidated it. But in the end, they're pretty much the same.
Gotcha. So, okay. So I know like my fiance is a nurse and she had to do clinical. So when you're in school, I mean, are you working on people's teeth for free, or what is that like?
At a very reduced fee. So they still pay a fee. So your first and your second year, you're mostly classroom, and then usually it's one, sometimes your second year, 2 days a week. At least this is how my school did it. And then that 1 or 2 days a week, we would be the assistant for the upperclassmen. When you get to your third year, that's when you have to actively find your patients, take them through step one from, diagnosing and x-rays, and then take them to whichever department they need, whether it's fillings, they go to operative, if it's oral surgery, for extractions. So whatever they need, that one patient stays with you, and you take them to the different clinics to do, or the different departments to do what needs to be done. And again, it's still a fee for service, but it's a greatly, greatly reduced fee. That's been 28 years ago. So, I don't know how it runs now, but back then, if a filling was $200, then they might pay $25.
Oh, wow.
Yeah, so it was crazy reduced. I'm sure it's a little bit different now, but it still is a reduced fee.
Yeah. So you said 28 years ago. So when you first get out of school, you have your practice now. I mean, when you first get out of school, do you go and you work with another dentist? Because I know right now you have another guy who is, I guess, relatively new.
Relatively new, yeah. So for me, I mean, it really depends on what you want to do. I had classmates that they were from small town Mississippi. They knew they wanted to go back there, and they straight up bought their previous dentist practice and they retired. It was just almost flawless for them, except for the fact that, you know a lot coming out of school, but it's still nice to have a mentor, close by. So I had those. You have those that go into the military, or you just work as an associate for someone. And that's what I did. So I worked in Mississippi for a little over 3 years, being an associate. And it was time for me to buy into the last guy I practiced with, his practice, which was in Starkville, Mississippi. So I kind of feel like I gave every major university in Mississippi money because my undergrad was Southern Mississippi. My dental school was Ole Miss, and then the last place I practiced dentistry was in Mississippi, where Mississippi State University is in Starkville. So I just it was a cool place to be, but I thought as an adult, maybe not the best place to be in a college town, and I was only licensed. So some states you're licensed when you do their board, they're with like 13 other states. At the time, I'm not sure about now, but at the time Mississippi was on their own board. So I was only licensed there, but I wanted to move away just for like a year, just to do something wild and crazy. So I looked in the back of the journal, and you could work on any state license at any military facility, at an Indian reservation or Native American reservation, and a prison. So I actually went and interviewed at one of the prisons because it was in a cool place, I thought, and it was maximum security. And as soon as I got there and saw all the machine guns and the barbed wire and the doors, I'm like, yeah, I don't think I can work in a prison.
Yeah.
So,
Wow.
it's like not for me. So that's how I ended up here. Again, I just wanted to move away for a year until I found that perfect practice back in Mississippi. So I came up here, worked at Sewell's Point in Norfolk, and did that for about 2 years, and then decided that I was staying here. So I got my Virginia license. I worked as an associate for a little over 13 years for a big group practice here. And then this opportunity came about, and I'm like, you know what? It's now or never. And that was 9 years ago in April.
Wow. So you came up here and you said you worked at Sewell's Point. Was that related to the military? What drew you here exactly?
Yep. So I was a contractor for the military. So they have, you can join the military and become a dentist, a Navy dentist. But they also they have need for more dentists than that. So you can be a contractor where, just like GS workers for the government. So you have privileges to go on base, but you don't have all the other stuff that comes with it. So you show up, and you're actually hired by a company at that time out of Texas to go fill whatever position. So they had like a list of bases that you could go work at. And I picked here.
Wow. Well, I'm glad you're here because you fixed my tooth.
Thank you.
So tell me about like when you acquired your practice 9 years ago, how do you go about like building your clientele?
So I was fortunate that the practice that I worked for 13 plus years was right down the road. And they have several locations. So they had moved me. In the time I was there, I worked at 4 of his locations. And typically, whenever I went to a different location, I was fortunate enough to have patients follow me. And then I was at close to the city. I was on Shore Drive, and then they moved me to General Booth. And I had people from Shore Drive follow me, and that I knew lived right down the road from Shore Drive. So the fact that they drove to General Booth, which is not that far, but middle of the day in traffic, I mean, it's not that convenient. So, and I just started, questioning some things. So that gave me the confidence, like, well, they're driving from over here to over there to see me, and my location now was closer to the Shore Drive area. They're going to follow me to General Booth, and chances are they'll follow me if I leave the practice. And so took a leap of faith, and it's been good to me ever since.
What is
and
that?
Then, we're very embedded in the community. I've got 2 boys who are now, one's a freshman in high school and one just finished his freshman year in college. At the time, they were, I guess, 1st grade and 5th grade, maybe, I think, when I opened this practice. So my husband was a coach for the 5th graders baseball team. I was a coach for my younger son's baseball team, right down the road at Breakneck Baseball. Then we both did basketball. So, I mean, we were, church, the schools, we were pretty embedded in the community that, we just felt like we had enough ties out there that people would be supportive of us.
Yeah. Well, it seems like it's going great. That's awesome.
Yeah.
So, okay, let's talk about teeth now. I saw a while ago, like a x-ray of a child. I think it was a child, and they had there was teeth upon teeth.
All over the place.
I mean, that's insane. So yeah. I guess, I don't know. I don't even know what question I'm trying to ask here, but what is the process of of teeth, how does that even work? Is that the muscles in your face working them down?
So it's when you see them, they almost look like they're stacked on top of each other. Most of the time, what you're seeing up top is we call them tooth buds. So, just like a little rosebud starts off as all closed together and it starts to blossom. So with the tooth bud just looks like a little circle when it starts to develop. And the older you get, the more developed that starts looking more and more like a tooth. And then the root starts to grow. So those are in the bone. And the whole histological process of when you lose a tooth, a baby tooth, when it starts getting loose, it's because its root is dissolving. So in the bone, what you don't see, when that tooth gets wiggly, it's because that root starts dissolving. And as that root's dissolving, it's promoting the tooth bud of the permanent tooth to continue to develop and sprout that tooth as well as start coming down. So it's all in the bone, not really any muscles involved with it, but it's just a whole cascade of events that tells the baby tooth getting loose, tells it to get loose, and tells that permanent teeth to come on in. And all of them have a sequence of events. It's kind of a standard on when a baby tooth comes in. If you didn't get your baby tooth till late, if your mom says, oh yeah, you took forever to get your baby teeth, then the chances are you're going to keep them longer and it's going to take longer for the permanent teeth to come in.
Why do we have baby teeth? Is it just because there's a lack of space? I mean, we don't have like baby femurs that.
Right. It's a great question. I mean, I think it's fortunate because I wish there was a third set of teeth because, when your kids, either if your parents didn't grow up with the best dental habits, chances are it's not that you get your teeth. You do get some hereditary things with your teeth, the shape. Sometimes there are some enamel defects, but you'll commonly hear people, oh, my mom's teeth were soft, so my teeth are soft. Might have some smidgen of a validity to it, but more so it's habits, so unfortunately we pass down habits to our kids. So the reason why I said I wish we had three sets of teeth, there's a lot of kids that, there's tons of sugar out there, or the parents put the baby down with bottle or apple juice and they get cavities, and so you get a redo with your permanent teeth. And it's important to fix those teeth in the cavities in baby teeth, because some of those baby teeth you're going to keep until you're 12 years old. So, let's say you had a barrage of cavities. Then when you get your teenage years, we rebel, we still have, the Powerades and the Gatorades and the Sugaries and stuff like that. And unfortunately, the habits that we have as a teenager that we might want to try to change as an adult might be a little late. Even with the best restoration on a tooth, whether that's a filling or a crown, it's still not as strong as a, virgin tooth that never has had an issue to it. So that's why I think a third set of teeth, maybe when we're in our late 20s, would be great, because we usually become better health providers for ourselves when we're in our late 20s. But the other thing is the teeth, bones will grow with you, and teeth, because of spacing, because of chewing, God just didn't design it like that, So if you stay with those little tiny baby teeth as an adult, I think we'd all look a little deficient,
Yeah.
But it's a great question. I mean, evolution, I don't know what the true scholars would say about that, except for they just don't grow. They're not like the bones that will grow when you grow. The teeth are the size that they are. Same way with permanent teeth. Sometimes you'll see an adolescent whose front two teeth come in and they look enormous for that kid at that time, because, you get those when you're 6 to 8 years old. And then you see that person, as a teenager, as a young adult, someone that you had seen as a baby or as a young child, and you think, gosh, they got some Bucky Beaver teeth. And then you see them as an adult. It's like, wow, they've got a really nice smile because they grew into those teeth.
Interesting. And I've never heard anybody say they wish that we had a third set of teeth, but that would be good. And that makes me question, like, is damage done to teeth kind of irreparable? Like, if a smoker quits smoking, then their lungs like get better over time. So if you start developing better habits in your 20s, is it possible to kind of like save your teeth?
Yeah. Yeah. I mean, even if you'd had a few fillings or a crown here or there, it's almost never too late. If you've got really good habits, because not only the teeth, but the foundation, if the gums don't have good health, which is called your periodontium, if that doesn't have good health and you get periodontal disease, your teeth can be completely healthy. But if the gums aren't, then you can lose teeth because the gums and the bones aren't healthy. So even if you have a couple of cavities here or there, if you start really, really being astute with flossing in particular, cutting down on at least not drinking sugary drinks all day long, watching your acid intake, you definitely can. You're not going to reverse any cavities that you had, but you can minimize, if not completely eradicate, you having any problems in the future. A filled tooth isn't doomed, but a tooth that's had filling after filling after filling because, you weren't taking care of it, or you did things with your teeth you shouldn't. Chewing ice is really bad for your teeth. Over this whole pandemic stuff, the clenching and grinding incidence has become just through the roof. The number of teeth that people break just from clenching and grinding, which could be not completely prevented, but lessened if you had a bite guard at night, because we all do some clenching and grinding at night, especially if you're under stress. But even if you're not, if you've got, a backache, if you're in pain, if you get headaches, those things usually are triggers to make you clench and grind more at night, if that makes any sense.
Yeah.
So yeah, it's not too late. Where it's too late if someone has rampant cavities on almost every tooth, and because of finances, because it's not inexpensive to fix a tooth, you settle for the less expensive of the restorative option. Chances are, those teeth, if they have to be restored and restored again, or if you don't change your habits, then that's when you're looking into some tough stuff.
You mentioned flossing, and I know that's like the big thing that dentists really push. I mean, how much do you think patients are actually flossing? Because I'll admit I don't do it nearly as much as I should, and probably only when I come to see you guys is when it really gets done.
Right before y'all come in to see us. I mean, obviously the answer is at least once a day. But people, life gets in the way, all that good stuff. But that's what we would ideally like to see is once a day. If you can at least do it, 3 times a week, then I would be somewhat happy with that. Still, nothing's going to replace once a day. If you know that you're not a good flosser, the validity of an electric toothbrush and a water floss is truly valid to use those. Still doesn't replace the flossing, but if you're honest and say, I know I'm not going to do that, use an electric toothbrush because it penetrates better. And if you can follow through with a water pick as well, then that pressure wash, is going to get what can stay in between your teeth or underneath your gums that your toothbrush can't necessarily get. It's going to help you out. Again, it's not going to replace it, but it's going to help out.
What is the actual benefit of flossing? Like, if you don't floss, is it like what damage is being done?
So it could be twofold. So, your teeth touch, and where commonly you'll have someone that'll come in, has pristine looking teeth from the surface. And then we take the x-rays, which is important while we take the x-rays. A lot of people don't want it because they think it's covered with radiation, and it's not. I mean, the amount is less than what your microwave gives off when you use your microwave every day. But without those x-rays, we can't see in between. So the tops of the teeth could look amazing. And then you get that x-ray, and if we see a little radio lucency on the x-ray, because enamel shows radio opaque, looks like bone on an x-ray. If there's a cavity, it's going to look like a little black hole, and especially in between the teeth. So if where those teeth touch, if you're not flossing, then there could be plaque and bacteria that stays right in between those teeth. So that helps minimize the risk of getting the in-between cavities. The other thing is, once you pop down past that contact where those touch, then you're getting on the base of the tooth, where the gums touch the root. So if you're not cleansing in there, then again, your toothbrush can't get underneath that gum level. So if plaque gets underneath there and sits for 24 to 48 hours, then it can get mineralized into tartar. If tartar stays below the gum line, then that's when you start getting the ligaments to be unhealthy. That's where gum disease comes from. So all the structure that's holding the gums and the bone to the tooth, if a piece of tartar gets underneath there, then that starts loosening those attachments. And that's where you can get some mobility and inflammation and bleeding and pain in the gums. So twofold, to prevent cavities and to help prevent gum disease. What
exactly is plaque? I mean, we hear about plaque all the time. Is it like food residue that is compounding? Is it like, I mean, I don't even know.
Yep. So it starts with whether it's food residue or it's the sugary aftermath of a drink. And then that is what fuels. There's natural bacteria that occur in your mouth and that you need. But there's also bacteria that's in there that if you give them a little bit of sugar or a little bit of acid, then they're going to start replicating. You know, it's almost like like fly paper. So if you have the sugary residue of a drink, or if you have, food particles, especially, you may not even see a piece of food, but there's still a residual film that stays. And that's kind of like fly paper to the bacteria. If a fly lands on a piece of sticky fly paper, they're stuck. So if you've got that over your teeth, then the bacteria are going to start coagulating there. And then that bacteria either is going to lead to that tartar buildup, because once that becomes calcified, then it becomes hard and your toothbrush will not, it's stuck to the tooth and your toothbrush won't get it off. That's when we have to use our nice little sharp scalers. And, it's like, oh man, she was digging all day long. That digging is not truly digging, but it's releasing that calcified plaque, which is also called tartar or calculus, off the tooth. Or that sticky paper attracts the bacteria that then eats into the tooth, because those are the cavity causing bacteria. So there's different colonies of bacteria. One's responsible for the gum disease and one's responsible for eating away at the tooth and becoming a cavity.
You mentioned gum disease and cavities. What are some of like the most common issues that people come in with to see you?
It's funny. It kind of comes in waves sometimes. I mean, sometimes you'll have just one gum disease person after another. And that varies. That can be in its infancy, that as long as, they're doing, sometimes they have to have more frequent hygiene visits with us, because it's not just cleaning your teeth. If you have gum disease, then the gum pocketing is deeper, and your toothbrush, your floss, nothing's going to get to that base. And gum disease is a treatable, maintainable disease, but it's a chronic disease. So once you're past a certain point with gum disease, then you're kind of always susceptible unless you're really keeping up with it. Like diabetes 1, you never get rid of diabetes 1, but you can control it with diet and sometimes medications. So gum disease can be the same thing. As long as it's identified, it's educated about, and then we do our part, you do your part, then you can keep it at bay. But gum disease can be really, really tragic, because it may not hurt. It's not necessarily like a cavity where you're going to feel something sweet or something cold. It usually doesn't hurt. You might notice a little bit of bleeding, but it usually doesn't hurt until it's pretty progressed. And then when it's to that stage, all that bone and gum attachment usually just dissolves away. And that tooth is just kind of like a anomaly in that it's even there, and then you have to take it out. Cavities are pretty prevalent, and unfortunately we've seen a decline with kids' cavities for the most part. Where we see an uptake in it is college age kids. Then you'll have like a stagnant phase where maybe your 30-year-old doesn't have that many. And then you reach your maybe 50 plus year olds, depending on their medications. If you get dry mouth because of medications or just because their body composition changes. When you get older, you can see a higher incidence of cavities. You'll have people that come and it's like, man, I hadn't had a cavity in 30 years, and now you're telling me you have cavity. Well, things have changed, and again, medication plays a big role in that. But yeah, I mean, it can vary. That's what's so cool about dentistry is you just never know what's going to walk in that door. If you get someone put on your schedule for a toothache, that toothache could be completely gum disease related, or it could be completely a cavity related.
Yeah. What about something like, I think this is something I have, or we talked about once, is geographic tongue. Like, What is that?
It's when your tongue looks like a map, pretty much. So, everybody has papilla on their tongues. And, for the most part, everybody's tongue is pink and a uniform coloration or the topography of the tongue. Well, sometimes if you have a geographic tongue, when you look at your tongue, it looks like a world map. There's like circles or lines that are, some are a little bit whiter, some are a little bit pinker. A lot of people that have it don't even know they have it unless they just stared at their selves in the mirror and looked at their tongues and their teeth and stuff like that. Sometimes the geographic tongue, if you've been sick, if you had spicy foods, it can be a little tender or sensitive. So a lot of people realize it when they come in. They're like, man, my tongue I can't eat that hot salsa anymore. Or I had the flu last week and my tongue was really sensitive to carbonation, spicy foods, salt. So there are times where that becomes kind of active, but there's absolutely no risk factor with anything truly harmful. There's not a cancer related to it or really anything to do. Sometimes if it's in a really flared up moment, then you could do steroid rinse if you need to. But most of the time, it's just something cool for us to talk about and cool for you to, look in the mirror and be like, oh, yeah, it's like a map. And then that's it.
You mentioned cancer. So there's kind of two avenues I want to go down here. First one is I had cancer, as you know, and I had thrush as a result of the chemo. So, how does kind of the mouth work in unison with the rest of the body?
Very much. So whether it's, something a little less daunting, like high blood pressure, you can see that sometimes with how the gums respond to, anything we do, because they can have edema in it. They can be quicker to bleed. Diabetes, the same thing. We can see some mouth problems like that. And then you go into the thrush. So whether it's chemo or someone who's had just some major infections and they've been on all kinds of antibiotics, well, thrush is because there's normal flora. So flora is bacteria. So there's normal flora in your entire body. And if you wipe that out, then you're susceptible to yeast, fungal infections, or colonies. So thrush is a fungal infection, or not really infection, but just a colony that sets up and it hurts. So you've got to treat that with an antifungal drug so that your normal flora can get back into sync and you not have this painful yellow coating on your tongue. The cancers, there are very few, but some cancers that will manifest in the mouth. We had one a couple of years ago who was actually a friend of my son's. He had leukemia, got cured, rang the bell, everything was good, tough 8 months. And then he called one day, he goes, hey, I've got a little sore spot. I think it's my wisdom tooth. We knew he needed his wisdom teeth out, but I did an exam. I'm like, that's a pretty impressive lesion in the mouth. And in a matter of, it's very, very rare, but in a matter of like 2 weeks, it went from really small to really big, painful. We got him checked out, and he had a different cancer, and it was testing in his mouth. So here this kid rang the bell after 8 months, and then this other cancer comes up. They treat it. He lost a couple of teeth because it deteriorated the bone. They treated that and then just decided, because that was so rare, like 1% that's ever happened, so rare, that he needed a bone marrow transplant, because the risk of him having another cancer, whether it was somewhere else in the body or back in the mouth, was pretty high. And that's not a way for anybody, and especially a 17-year-old, to live the rest of his life. So he did a bone marrow transplant. And as of today, he's doing pretty good. Just finished his first year of college. So that's one thing that's very rare, but that I've seen. More so what you'll see is oral cancers that are related to tobacco and some alcohol. And, unfortunately, over the years, I've had, some patients that we've caught it. And, I've had a couple that have had half their tongue taken off, but they're healthy. They're fine. I've had a couple that unfortunately we found the cancer, and they went and sought treatment, and then it was, a little too late, because there are some things that can be aggressive in the mouth. How do they appear, or what do they look like, to someone who doesn't know what to look for? When we'll do our look, your eyes are your biggest tool with that. But then also you're going around and you're feeling, even if you have like a lump or bump that you feel somewhere, if there's symmetry in it, then it's normally fine. If you felt extra bone on the right side, and then you felt over on the left side, and you had it over there, then that's something that's normal, that a lot of people have. We call that tori. But if there's something or if there's an ulceration, everybody's gotten an ulcer because they slipped with a chip or their toothbrush. Ulcers in the mouth that don't hurt are the ones that we get really concerned about, because that's normally a squamous cell that starts, most of the time a squamous cell that will start, and we see it, or you might have seen it, and you're like, yeah, it kind of felt a little weird, but it's never hurt, because most ulcers really don't feel good. And again, the most common reason for that is tobacco. HPV comes into play some, which is great, because most everybody has the vaccination now. But unfortunately, the chewless tobacco and the smokeless tobacco is the most common thing.
I'm glad your son's friend is doing better. That you actually went down the other avenue that I was going to ask about, which was oral cancers. So you mentioned earlier, or you mentioned with that your son's friend, the wisdom teeth. Is that something that you do, is remove those?
Not, I wouldn't say never, because I do enjoy taking out teeth, and I do take out some wisdom teeth. The majority of the people that need their wisdom teeth taken out have all four. They're normally either semi-impacted or completely impacted, which means that they're completely impacted, they're completely covered by bone. They may be laying sideways, pushing up against the second molar, so you want them out so that there's no damage done to the second molars, no nerve damage, and they can just cause some gum disease and things like that. If they're semi-impacted, that means they've broken through the gum tissue a little. You might can feel it with your tongue, or we see it in the mouth. If it's either of those, semi-impacted or impacted, let's send those to the oral surgeon. They can cause a little bit more discomfort. If it were for myself or my kids, I would want you to be, sedated so that you don't feel the pressure, you don't hear any noise. And when you wake up, they're done, So on an occasion, I do take out a wisdom tooth, especially if it's just one. But for the most part, just for your comfort and, just the ease of how the oral surgeon can do it, then I'm going to send you to them.
My oral surgeon who did mine is, I don't remember his name, but he's in prison now for dealing opioids.
Yes. Unfortunately, that's a very sad story, but it shows the power of opioids, because, it's It's something you can't control. And that's with the wisdom teeth. It used to be customary to give a big old bottle because it can hurt. You get a tooth pulled, it can hurt. You get 4 of them pulled, it can hurt. Mm-hmm. So you get a big old bottle of opioids to help control the pain. And truth of the matter is maybe you only needed 6. So it just shows the power that someone who had all the knowledge in the world and was a phenomenal dentist. His skill set was amazing, but for whatever reason, that came into his life and it completely altered his future, because it controlled him at that moment, So yeah, and with that, my son he had 7 wisdom teeth. So occasionally you can have 1 or 2 extra. I've never seen 7 before, which I tease him. I'm like, that's why you were so smart. I don't know what you're going to do now because they're all gone. So he had the normal 4, the normal size one, and behind 3 of them, there was a tiny little extra tooth bud, kind of, but a true tooth. But for him, because we have a friend whose son, at age 23, OD'd on opioids, or what started with opioids, and then just went down this vicious cycle. So, as a parent, then I'm like, I don't want you even having one. As a clinician, I know wisdom teeth can hurt. So it's that fine balance. But taking a combination of Motrin and Tylenol in much higher doses than what's on the label, if you do that and keep that in your system every 6 hours, then theoretically that's as good of a pain pill as a pain pill without the addiction properties. So, for him, I kept him with that, with the Motrin and Tylenol combination, never took any of the opioid. The flip side to it is, if you're really in need of it, pain's a vicious thing too. It can elevate your blood pressure. I'm sure during some of your treatments, when you were actively fighting cancer, I'm sure you probably had some because, the pain is real, so there's a place for it, but it just has to be done in a very wise, controlled way.
Yeah, when I had my wisdom teeth removed, friends told me, like, you won't do it without sedation, so I just had local and I didn't have any of the other stuff. And I didn't take any of the opioids for that. I just took the Tylenol and Advil, like you said, and I was fine. So yeah. I guess it just depends on the person, really, like your pain tolerance.
Yeah, it is true because people have different pain levels, and it's perception too. 10 years ago, if that's what we would have told someone, because everybody was getting it for, if they stumped their toe, they would go to patient first and get, 6 Vicodin. So it was just kind of, we didn't know it was as bad as it is a few years ago. So, I think that was just the norm.
Spider-Man has the famous quote, I guess his Uncle Ben says, with great power comes great responsibility. When you're prescribing meds like that, do you use discretion at all? Or, how does that work?
Well, and you have to now. And actually, for my policy now, I don't prescribe them at all. So now it's so regulated. There are so many things you have to do. You have to kind of vet the person, meaning, you've got to ask all of these questions, which some people get very offended with. What's their alcohol intake? Do they take any sleeping pills? Do they ever take any anti-anxiety medication? And if any of those if you answer yes to any of those, plus there's something called the physician's pharmaceutical monitoring that we have to, there's a database that we can type your name in and see every medication that you've ever had. If you don't do that, especially if you're given a certain amount of Vicodin, if you don't do that, then we can get fined, or if not, get our license taken away. So there's so many steps now. Or, like I said, if you answer yes to alcohol or Valium for anxiety, or any antidepressant, sleeping pills, then technically you're also supposed to get a prescription for Narcan, which is, what the police and the hospitals use if you've OD'd. Mm-hmm. So you hand somebody that, and then they're like, "Oh, I'm not a drug addict." I'm like, "I know, but because of these things, one of these things, I have to give this to you now." So it complicates the whole. There's a lot of us that have chosen that it's not worth the risk to us. It's not worth the risk to you, because you never know when someone's being completely honest, or honestly when someone's got that addictive property to them. There are definitely some studies out there, just like with alcoholism. There's some people that can drink someone under the table and still not be an alcoholic. And then there's someone who can have 2 drinks and that triggers there. And now there's somebody that has to have alcohol every day in their lives. And I think that's the same, that can be the same thing with narcotics. So you just have to be very, very careful. That's not something, like you said, great responsibility. It's not something that I want to ever contribute to someone's demise. And if I can control their pain with Motrin and Tylenol or steroids really help control pain, because a lot of pain is from inflammation. So if you give a round of steroids and you're controlling that inflammation, and if there's any infection, if you need antibiotics, then typically you are taking care of the patient's needs.
Very interesting. Well, your son had 7 wisdom teeth removed. That kind of gave me this weird question, related, kind of not related, but has like a tooth transplant ever been, is that something that's ever happened or talked about? Like if somebody loses
they've done some studies with it. So interestingly enough, I don't know what year it was, but way back, they were finding skulls in the Polynesian islands that had seashells embedded in the skull, which means that the bone truly formed around it. Typically if you have a foreign object embedded in you, the bone won't form around it, whether it's in your leg or in your jaw or in your skull, because it's going to see it as a foreign body and your body tries to attack it, and it's going to stay infected and it's just not going to take. But if you are finding these fossilized skulls that have seashells, just like your teeth would, because if you die with your teeth, then, you've seen skulls that have teeth in them and you can't take them out. There you go. So that person had healthy gums and bone around that tooth when they died. So these seashells had healthy tissue and bone around it. So some plant, because most of our pharmaceuticals come from plants, so I'm sure there was something that they could use that helped mediate that. So as far as taking a cadaver tooth or a true tooth from that skull and embedding it in someone, and as of right now, that's not an option. But taking a titanium implant and putting it in place of a tooth, that's completely an option. That's highly successful. But it's pretty interesting, because partly why we think the Polynesians did what they did is it probably wasn't just a seashell. There was probably some coral involved. So coral is very similar to bone. And there are some studies out there that they're trying to regulate coral, whether it be for a tooth or, a fracture that doesn't mend well. I think we're still a ways away from that, but it's pretty intriguing. If you ever watch any of those crazy discovery shows and see where people want to grow horns or, the vampire stuff, they're actually going to these bootleg places and getting coral placed, and then that coral grows. To my knowledge, I don't know if we know how to shut it off. So that's the problem. So you don't know how to shut it off. There's a lot of research with it, right now, because implants are so good. I don't know how much focus will be on that particular type of research, but it's intriguing if you look at a little bit of the research that's out there. So the answer to your question is no, not yet. Do I think it might happen? I do, eventually.
Sweet. What about like veneers? What is that made of?
Usually it is a porcelain veneer or a zirconium veneer. So basically it's a highly filled ceramic material, even silicate particles. So, almost like glass, but the way it's fabricated in the lab makes it stronger. And it's particularly once it's bonded onto the tooth, then technically it's as strong as what the tooth once was.
So how you said it's bonded to the tooth. So what do they just kind of grind it down to nubs and then stick those on?
Yeah, and it depends on if it's a veneer, then you're only removing 1 millimeter of enamel because you want to still have a good enamel surface to bond that to. So veneers have a very limited application. If someone wants, white as this and they can't get their bleaching, but their teeth otherwise are in the right shape and look good, then veneers, most of the time when you see the celebrities that have just what looks like this gorgeous smile, it's either veneers or crowns because you just can't get your teeth that white. If it's a crown, so with a veneer, you're just doing the front part of the tooth, maybe a little bit of wrap around, but pretty much it's just the front. If you need a crown because it's a back tooth, it's been heavily filled and structurally it's just not strong anymore. If you've had a root canal, if there's a crack in it, that's where you cover the entire tooth like a glove on the tooth. And you're taking away a little bit more tooth structure so that the thickness of that crown is at least 2 millimeters of zirconium, most of the time, of zirconium material. And then when you get it back from the lab and you seat that crown, it fits in with the rest of how your natural occlusion was, but it's thick enough to be strong enough. And so then you take most of the time a glass ionomer or cement, and it bonds to the tooth and it bonds to the crown. Put it on there. You zap it with our light, which you've probably seen if you've had a filling before. That light makes it set and it gets hard very, very quickly. So it's usually a mechanical and a chemical bond that you're getting.
I'm just an idiot, so I didn't realize. I just figured that veneers were like totally new, like all the teeth were pulled and put these in, but I guess that makes way more sense.
Yep. So it's almost like, if I needed to do something, you're taking a sheet of porcelain and it's covering the tooth, but you had to take away a little bit of the tooth to get this to bond to it and to not feel like you're Bucky Beaver because you've added without taking a little bit away. Mm-hmm. Whereas a crown's going to be, thicker, more, and cover the entire tooth.
All right. So we'll use that as a segue into, I think it was like 2014 or 2015. I was carrying a table. I worked at a golf course and I was carrying a table and the leg hit the door frame and the table hit me in the mouth and knocked like half my front tooth out. So you saved the day. I was able to get in there same day, I think. And, and you, I guess, grinded what was there down and then you take it from there.
Yep. So I think probably because of your age at that time too, we ended up doing composite, which is a filling material that's white. And so we ground away the sharp edges that were there and also kind of roughen the surface up so that I have more of the tubules of the tooth, which is like the pores of the skin. So bonding to those tubules is what holds the material in place. And then you do a couple of preparatory things for the tooth to receive that composite. You sculpt it, you light cure it, and then it gets hard and it's shaped like the tooth and looks really, really good for an extended period of time, depending on coffee, tea, smoking, red wine, things like that will stain those in due time. And the use, especially where those were in the front, you're biting surfaces, you're biting into a lot of corn on the cob, apples. If your bite, the way your teeth come together isn't ideal, then that in and of itself can wear those composites, can wear your teeth down. So I think at the time, one, we didn't want to do full coverage crowns. because you don't want to do this too early because the teeth still have some growth to it, meaning that the gum level may change a little bit if you're 16 to 26. And then too, if you have someone that comes in like that, and maybe you want to do some orthodontia, some braces or Invisalign to make things just the most ideal, not only aesthetically, but functionally, the way those teeth come together. If they're coming at an odd position, then you will definitely wear your natural teeth down in an irregular pattern. If you put bonding there, that bonding is going to get, or even a crown, it's going to get more stress than it should, and it won't last as long as we would like for it to last. Nothing man-made is going to last forever, but the longer we can get a restoration to last, then the better off everybody is, So an average lifespan of a filling like that can be 5 to 7 years. Some can be longer, some can be less. But the more ideal your bite is, then the longer stuff like that's going to last.
So it sounds like I'm due, and I'm going to need you on retainer the week of my wedding.
Okay. All right.
So like when you're doing that, I mean, what is it when you're making this stuff that's going to my teeth? Does it look like you have a piping bag and you're icing something, or is it like a 3D printer and it's just kind of like spitting out? I mean, what does that look like?
There are 3D printers. We don't have one. I still, if it's not going to be with the filling material, the tooth color bonded material, if I need to make something like a veneer or a crown, I still personally feel that the lab can make that better than what a machine in my office can. But if it were a filling like we did with yours, then the filling almost is like a Play-Doh. So it's soft-ish, again, like a Play-Doh would be, so that when I put it on the tooth, I'm using my instrument to press it into the tubules of the tooth, but also to shape it just like your adjacent teeth are. Once I get that shape, it's still in that Play-Doh-ish form. When I hit it with my curing light, which is my blue light, which has the appropriate wavelengths to be the catalyst to make that material start setting up. So when I hit it with the blue light, then it starts to bond to the tooth and becomes hard. Once that happens, then, it's solid. And from there, whatever shaping I couldn't do with my instrument when it was Play-Doh, then I pick up the drill and I have a finishing burr, and I continue to kind of sculpt until it looks really good.
Interesting. Well, thank you for doing that for me. I appreciate it.
You're welcome.
Going back to like, what are some of the common things people come in with? Is a dental injury pretty common? And who is having the most dental injuries?
I would say you get a dental injury, a significant dental injury, probably, I don't know, once every 2 months or so, and I've had over the years a variety of them. I've had someone playing with their dog and playing tug of war, and, we all get down and play with our pets, and then they, inevitably their head hits your tooth. Sometimes that results in a chipped tooth. Too, I've had it where nothing chipped, it just really hurt. And then a month later, because of that trauma to the tooth, the nerve inside dies and you have to have a root canal, even though nothing chipped on the tooth. Car accidents, obviously. I had one the other day that the guy was in his boat and he heard a noise, so kind of leaned down a little bit to see where the noise was coming from. And when he did, he hits a wave and he knocked the steering wheel. So, chips with that. Obviously there's sports injuries. I had someone similar to your injury at work. They were moving things at Big Lots, and, something came down off the shelf and ended up breaking off several teeth. It can come in droves, and then you won't see one for a while, and sometimes it's something that, unfortunately with dental insurance, even, luckily for you, it happened at work. So workman's comp normally takes care of something like that. If you were walking your dog, I've had someone who's tripped on a crack in the sidewalk walking their dog and fallen and broken their teeth, and there is not any additional insurance coverage that's going to help. And that can, if it's a simple chip, fillings, aren't necessarily inexpensive, but it's not like losing the tooth and having to go with dental implants. Probably my latest one was a baseball player at Tech during practice. They were practicing pickles, and running people down when they're trying to race. And unfortunately, during that process, he gets hit right in the front and breaks the tooth off at the gum line. And so from school, he sends me a picture. I'm like, can't fix it. It's got to have an implant. For his benefit, the school's going to help pay for that. But if you're in the backyard and something like that happens, and that's quite a bit of money, to have, and quite a bit of time, because an implant can take almost a year before it's done from start to finish. So it's a very broad answer, but I mean, it really, really varies. It can be something very, very simple to laser tag. There was a while where I'm like, okay, my kids are not going to laser tag because I had at least 5 injuries from the gun hitting the kid when they rounded the corner. And, depending on how aggressive that turn was, occasionally it was once it was the total tooth was knocked out. So sometimes it's a chip and sometimes it's much, much more than that.
Yeah. And the laser tag place probably isn't liable at all because they make you recite that thing. I will not run, climb, or jump, sit, kneel, or lie down. All right. So I don't want to keep you too much longer. I feel like we could almost do an episode 2, but I want to ask you 2 things: advice for future dentists and advice for people to take care of their teeth.
So advice for future dentists is, just compassion. I know that sounds kind of cheesy, but honestly, life gets in the way for everybody at different moments in time, and that's why I said, I think 3 sets of teeth would be amazing because none of us are perfect. There are moments in time where we've all, had too much sugar and didn't take care of our teeth or didn't floss properly, so compassion, not to be like, oh my God, you've got 28 cavities versus, wow, how did we get here? How can I help you? Being empathetic to that. It's a scary place to be. It's as much as we try for it to be comfortable, it's sometimes not comfortable. And, it can be quite a financial burden to get everything right. Even with the best insurance is very limiting. So listening, having compassion, and just really, you obviously have to have a little bit of book sense, but it's also just really wanting to help people. So, study hard, do good in all your sciences and things like that, but also know that there is a huge personal component to the profession that you're going into. And if you don't have that, in my opinion, if you don't have that, then you're not being the best provider that you can be. So that's my advice for anybody that wants to go into it. It is a very rewarding profession because, there are lots of happy tears that are shed. There's nothing more rewarding when you've really helped somebody out. When you came in that day and you were, scared and probably to yourself freaking out a little bit, like, oh my God, my grill's all jacked up and what's going to happen. And then you leave with the same, if not a better smile that you came in with. So, I had a lady the other day who had some pretty severe problems, and it took us multiple steps to get to where we got. And when I did her final restorations and gave her the mirror, the amount of happy tears that she shed. And I've seen her in Food Lion many times after that. And it's so comical because she gives me a hug every time I see her. So that's just really, really rewarding, And then as far as taking care of your teeth, was that the other question?
Yeah.
So, it's not being too neurotic with it, but it's being astute to it. I don't know, you're a healthy person, and your weight's in check, you kind of, the same way we want to keep our weight in check, you want to keep your teeth in check. There's plenty of people that don't. There's plenty of people that are overweight that you want to say, if you just do a little bit of exercise, you don't have to be skinny, but if you do a little bit of exercise, you're not going to be obese. You're not going to have heart problems. Or to that degree, you're not going to have the kidney issues and things like that. If you just spend a little bit of time to take care of something that once you're, 16, 18 years old, you're not getting anything different in here. And yes, we can fix teeth, but, there are people living until they're 100, 102 years old. And the older we get, then, one of the last true enjoyments in life is, besides being with family and friends, is your meals. You're not going out and running marathons when you're 90, but you still want to enjoy a meal. Not only enjoy it, but your health, your nourishment. If you're not able to eat foods and you're just drinking Ensure, you're not getting, the nutrients that you need. So just knowing that what you got's what you got, and if you're not taking care of them, yes, we can fix some things, but nothing's going to ever be as good as what you were originally given. So if you could just remember that mentality, and not let them go, things are going to happen. But when they happen, the earlier you fix them, then the better off you're going to be.
Awesome. Dr. Paige Downs, thank you so much for joining us today.
You're welcome. Thank you. See you next time.
We'll have to do an episode 2.
Okay, perfect.
Thanks for joining for season 2 of Dumbest in the Room. I just want to remind you that we're on all listening platforms. I also want to remind you that we're on social media at DumbestITR, on Twitter and Instagram, and on Facebook at Dumbest in the Room. I'd appreciate a follow and a like. Thanks so much.